Thyroid. Let's talk about thyroid. Either Hashimoto's thyroiditis, low functioning thyroid, and Graves' disease. These autoimmune and non-autoimmune thyroid disorders are approached, the treatment is approached very differently in functional medicine. There are numerous micronutrient deficiencies that influence how the thyroid functions. Specifically, when we look at thyroid hormones, maybe you've heard of free T4 and free T3. Well, the 4 and the 3 are the number of iodine molecules in those hormones. T3, free T3, is the active form of the thyroid hormone in the body. So we look at iodine, the amount of iodine you have in your body that makes those hormones. We look at iron, we look at B vitamins, we look at vitamin A, selenium, and zinc. And we also look at things that can cause the thyroid gland not to function, so toxins, heavy metals. So if you optimize a person's nutrients, micronutrients, many times their thyroid will begin to function normally. Additionally, if you remove certain things from the diet, if you have an autoimmune thyroid disease, such as gluten and casein, many times the autoimmune markers, antibodies to the thyroid, will decrease and maybe even go to zero. Another issue with thyroid diseases is that many times people have a virus that triggered thyroid disease. Also, antibodies can rise for approximately 7 years before the illness will ever manifest itself with hypothyroidism or hyperthyroidism. So looking at those antibodies even in children is imperative. I have an example from my practice. I had a young child come in that was constipated, and we didn't just do a thyroid stimulating hormone or a TSH and a free T4, but we did the entire thyroid panel, including thyroid autoantibodies. Well, we repeated it again to be sure that the numbers were valid. And this 3-year-old child was developing Hashimoto's thyroiditis. So I had to sit down with his parents and said that you have to change your lifestyle, your food plan, so that your little boy can be healthy. But what a wonderful thing to find this very early on in life, before he had developed huge levels of autoantibodies, ended up on thyroid disease or thyroid medication, and been treated allopathically. So that's how I approach thyroid disease in functional medicine.